The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic today, how to maintain and restore your youthful appearance. And with us, we have an expert on the topic. He is a well-known, in fact, world-renowned facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome to the program.
Randy, it's always good to be here.
All right.
Good to see you.
We're going to change it up a little bit. We're going to actually show a PowerPoint presentation that you show for public seminars. Is that correct?
That's right. That's right. Yeah.
Okay. Now, for people that don't know you, co-director of the UCLA Facial Plastic Program, the fellowship.
That's right.
Right?
Yeah.
And you've been a professor there for how long at UCLA?
14 years.
14 years?
Yeah, quite a while.
So all the young guys come in and...
Well, Randy, it keeps you young. It's really nice to see these guys coming through, and they go out and usually teach at universities afterwards, and so it's sort of fun. You feel like a father figure sometimes to them.
And big following. Hollywood is seeing you. A lot of celebrities when they want a natural look. Is that right?
We like to do a natural look that you look maybe 10 or 15 years younger, but really you don't look any different. And I know that sounds odd, but you almost have to see the pre and the post-ops for somebody to figure out. Many people's mothers don't know they've had anything done, or sisters or brothers.
Is that right? Is that right?
Yeah.
Now,
that's the key.
You know, I should mention something else too, because these photos literally are the best I've seen. And I told you, I feel like I'm a connoisseur now. You know, we're in 36 states. I've interviewed plastic surgeons all over the country, and I'm trying not to endorse you, but these, I think if people stay tuned, it really is amazing. It made me want to get something done because, I don't want to look different or feminine or anything like that. And a lot of men are coming in now for this?
We see almost 30% men.
Really?
They want to maintain their vitality, not necessarily look young, but look alert and receptive and with it, essentially.
Okay, so non-invasive, we're going to break it up into two parts, non-invasive, and then, of course, invasive, like facelifting, things like that. And so you're going to share your PowerPoint. So wherever you'd like to start.
And basically, let's start with non-invasive because it's really come a long way. We have so many options nowadays. Each one does a certain thing, and so people sometimes get confused. So it's worthwhile going through it a little bit.
Okay, let's take a look.
Okay, the saying is time may be a great healer, but it's a lousy beautician. Okay. So what we want to avoid as we age is that sad, mad, tired look, essentially, and revitalize ourselves. And people look older in the skin for a variety of reasons. One's intrinsic and one's extrinsic. Intrinsic is our natural genetic healing. If you live in Minnesota, you're not going to get as much extrinsic causes of aging as sun exposure, smoking, stress. We have a lot of stress today. So those are the extrinsic causes.
Where do you stand on technology as far as lasers and radio frequency and these things in your practice?
We always
have all the good stuff? You got the new stuff?
We have the new stuff, but we wait to see that it's proven and safe, essentially, before we incorporate it into the practice.
All right.
One of the interesting things is that stem cells are happening now. I helped to co-found a stem cell company that's publicly traded now, and what we've derived from that is some creams and serums that actually do rejuvenate the skin. It's not that stem cells haven't been used, but we have an ethical stem cell because it's not fertilized, so it could never become a baby. And the other problem is that they contain a lot of growth factors and things that really help us to look better, but those are destroyed in the preservatives of the cream. So what this company has done is taken some tiny little nanosomes from Japan and packaged all these stem cells and their growth factors so that they penetrate the skin better and the preservative doesn't kill off.
So it's a topical stem cell cream.
Yeah.
Real stem cells.
Yeah.
Okay, good. So it makes a big difference.
It really does. Yeah. It really makes a nice difference.
So stem cells are new. And what about technology, laser technology?
Well, a lot is happening. One thing, as you can see, is fractionated ablative resurfacing. And this is a way that rather than wipe out all the skin with a laser, which took a lot of healing and looked awful for a while, we put tiny little columns of laser energy into the skin, leaving normal areas in between that can heal the skin.
Okay.
And this retains the effect of the resurfacing, but it heals up quick. very few complications or problems, and really works nicely.
So fractionated laser.
Yeah, it's become a gold standard nowadays, I think.
Okay, and for sun damage, do you peel with fractionated laser?
It's sort of a peel, it's a rejuvenation, because it's a molecular change that occurs underneath the skin that's been defined pretty well by other people that really rejuvenates the skin. It may flake a little, but you don't actually peel, which is great.
Okay.
So you don't have that, that recuperation time that you might otherwise. We use the Pixel currently. We've used the Fraxel as well. I like the Pixel because it's an optical scanner and we can change the parameters and tailor them to meet the patient. And we have a lot of nice, as you can see, nice clinical results. This is a lady who had the undersurface of her eyelid wrinkles pixeled or utilizing the fractionated laser.
So that's a pixel right there.
It is.
With what I'm looking at.
Yeah.
Okay. And is that normally done under the eyes all the time, or you could do the whole face with a pixel?
We usually do the whole face and often the neck and chest, but the eyelids respond extraordinarily well. Now, Pixel is something that really lays down collagen under the eye.
So it heats the underlying tissues or the skin? I mean, what's the mechanism that makes it?
It puts down little columns of laser energy that produce some thermal damage or heat damage, and the body has to heal that. So it sets off a reaction in the body that lays down a lot of collagen.
Interesting. Okay, good.
Now this picture shows what it looks like immediately. It looks like a sunburn with little waffle marks, and those waffle marks generally go away in about 2 to 3 days. So people look just like they have a little bit of a sunburn.
But you could go back to work. I mean, with makeup, do you let them wear makeup?
Oh yeah, they can wear makeup, and go back to work. And in 5 to 7 days, they look pretty normal. This next slide is a picture of a woman who'd been out in the sun, raised in California, and you get that uneven skin tone with some spots that occur, the brown spots that look like they're aging or make you look older, but in reality, they're changes within the skin.
Is that an easy one to take care of, by the way? Like when you look at that?
It can be. It can take some work, but the fractionated laser really does a nice job with these.
Okay.
This picture shows acne work. And acne scars are real common, and we used to have to dermabrade it or take down all of the skin, and it was sort of a horrible process. But the Pixel really does a good job. Whereas we used to get about a 50% response, we're really almost up to 70 now. Now it does take a few treatments to get there.
So what happens? So the marks, the scar tissue from acne, the Pixel actually fills it in with your own collagen? I mean, is that what's going on? I mean, or is it peeling away skin?
That's partly it, and partly the fractionated area brings the surface down so that the difference doesn't look as great.
Okay.
But it is the collagen underneath the skin that really makes a difference.
Okay. Are a lot of people coming in for these acne scars, or you'd like to see more of them come in?
They are coming in, a lot of them. And one of the things that we're doing now, and that we've just started to do, so I can't comment on the effectiveness, but it's all over the world right now, is platelet-rich plasma. It's called a vampire lift or that type of thing.
I've actually heard of that.
Yeah, it actually works fairly well, where we draw a patient's blood and we take out that platelet-rich plasma and enrich it a little bit, and then go ahead and inject it under the acne scar.
Is that right? It's working. Okay, good.
Yeah. And this picture just shows the difference in the texture of the skin that can be achieved. And you can see how it's subtle, but it makes a nice smooth surface of the skin that really looks younger.
Okay.
And here, one of the things that we used to have a real tough time doing is reconditioning the neck or the chest. We often say that the neck and the chest gave away the person's age, even though you could do a facelift or something like that and really help it. But by redoing the neck and the chest with the Pixel, because we can do that without fear of scarring and other problems, you can see the difference that it makes.
Wow.
Yeah, you can see that this is the pre-op sun damage, and this is the post-op, how it's been reconditioned.
I mean, a lot of women have that, by the way, I see them, great skin, and then their, that chest area or
Décolletage, yeah.
Or décolletage, okay, seems to be, so you could take, now I guess just more treatments if somebody really has a burned area or burned look?
Well, one treatment does an awful lot with this.
Okay.
But some people get more. And you can work with color and texture. In other words, basically light can do a lot of things. It can be transmitted like light through a window, reflected like light off a mirror. What we want to do is basically transmit the energy through the skin and get absorbed in the reds and the browns that come with sun damage or growing older or that type of thing to smooth out the skin texture and color. That's called intense pulse light.
So with the guy that I'm looking at right there, it looks like a bunch of little blood vessel clusters. You can kind of wipe that out because that makes somebody look older. Makes them look like they're drinking too much.
Yeah,
as well.
Yeah, and that's a condition called rosacea often that even magnifies that look that comes with Irish people or Scotch or English people, Germans, Northern European people. So intense pulse light is a standard for treatment of this.
All right. Now what about tightening though, for people with a little bit of sag?
Well, you know, tightening, as a matter of fact, is my next slide, and we're getting
Okay.
Finally, we have some pretty good solutions for tightening. One of them is radio frequency, and we've been through a variety of these. We use a technology called EndyMed, and that technology drives the radio frequency energy down and produces a thermal damage underneath the skin without actually wiping out the skin. And that's been very effective. It's FDA approved, not only for the face, but also for the body, for tightening the stomach, for tightening that loose skin above the knee. Is it perfect? No. Is it the result that you get from surgery? Maybe not. Is it non-invasive?
So you're using it on jowls, though? How does it work on jowls?
On jowls, it works pretty good. And we've got two methods for doing that. One is EndyMed, the radio frequency thing that we mentioned. And the other is high-intensity focused ultrasound. And that basically, the sound waves do the work. You can image something with ultrasound, you know, and that's a very benign form. You can look at a heart, you can look at a baby and all of that type of thing. But with this high-intensity focused ultrasound, you can actually dissolve a prostate or a liver tumor. You can get that
really?
intense.
Okay. So now you're a facial plastic surgeon. And I mean, do you believe that if you get a woman in there, a man in their early 40s or late 30s, and do this minimally invasive stuff, you know, every 3 months or every 6 months, that you could possibly never have to do any surgery?
That's been talked about but never proven.
What do you think?
I mean,
you have all the new, you know, non-invasive technology.
We have, and I hesitate to make that claim, I'll be honest with you. But what I can claim is that it makes 95% of the people happy.
Okay.
And I'm happy with that.
I mean, but some people, could you make them look years younger with the technology?
Oh, yeah.
Like 5 years younger?
Well, let's take a look at a couple slides.
All right, okay. And by the way, if you're just tuning in, we're talking to Dr. Keller. He's facial plastic surgeon. We're talking about non-invasive right now, but you've got to watch. He's about to show some of these photos where the people actually look not only different, but natural, prettier, and a lot younger. So anyway, I just want to let them know they're coming up here.
Well, thanks. Going back to the non-invasive stuff, the way that they got approved from the FDA is to show that you can actually lift the brow a little bit.
Okay.
With these technologies. And that's really good because, you know, brow lifts and all of that, you know, are relatively invasive, and we've made them less invasive, but they're still invasive. So now not only can we lift the brow, but it's a technology that we can use to help even out both sides of the brow, non-invasively.
Really? Okay.
Yeah, so this is one girl. This is very subtle, but you can see that her brow's up, and these are all our patients, and we've measured the amount that happened. And here's a lady who's a little bit older, who we also lifted the brow and also tightened the face up a little bit. And you can see the difference, and we'll try and magnify that a little bit so you can get a better look. And you can see on the top, her brow's sagging a little bit. On the bottom, it's lifted.
And just with this, this technology,
It's non-invasive completely. The EndyMed, as I say, we do several treatments.
So EndyMed, it's a radio frequency?
EndyMed's a radio frequency, Ulthera is an ultrasound.
Interesting. So what's causing the lift, though?
The lift is the energy that we put underneath the skin, both in the skin.
But how is it picking up the brows? That's the part I don't get.
Well, when you put energy underneath, you get some contraction of the skin.
So it contracts up?
Yeah, not only the skin, but also the muscle contracts.
Interesting.
So you're able to lift the brow.
Now, aren't you the guy that invented I think the endoscopic brow lift?
That's true, I did.
Okay. Yeah. So you think this brow lift, for the right candidate, is a better choice for certain people?
It's the better choice for somebody who doesn't want to do a brow lift.
Okay, all right.
Here's a fellow that we'd done a facelift on years ago, and he just wanted a little bit of tightening, but he didn't want to do another facelift or a tuck-up or something like that. This was 8 years before, and you can see that it's held pretty well. He's in his 60s, But you can see that
Very interesting.
the non-invasive stuff actually picked that neck up a little bit. And again, it's millimeters, not centimeters. But
you definitely cleaned up his neck. I mean, when you look at the before and the after, I'm surprised that bothered him, by the way. Just that little bit.
yeah, when you get used to looking good, you want to stay looking good.
Okay, all right.
Yeah. Here's a lady who didn't want a facelift. I felt she needed one. She didn't want one. We went back and forth on it. So I want you, Randy, to take a look at a few things on this picture.
Okay.
Take a look at the neck. You can see how it's tightened up and how a lot of the wrinkles are gone.
Yeah, the before and after on the neck is a noticeable difference.
Okay, now take a look at the jowl. Can you see this area right here where there's a jowl and how this is diminished?
How many treatments to get that kind of result? Do you know?
This is one treatment with
One
the
treatment,
pixel
really?
and one treatment, with the tightening devices. Now, sometimes we'll couple a minimally invasive neck lift, which we call a web neck lift, with some of these tightening procedures to tighten up the face a little bit, and then minimally invasive lift the neck a little.
Okay.
So you can see on this lady, her neck's improved, and she's had a tightening procedure in her face that's also lifted her
So that's
brow.
not liposuction underneath the neck?
It's liposuction with tunneling and what we call a web neck. And we'll get into the different techniques, but she had a lot of muscle looseness, and the liposuction wouldn't have lifted that.
Okay.
And you can see it also lifted her brow and tightened up the area. If you look at the pictures around the jowl and around the face, lifted the brow. So she looks a lot younger, just with a minimally invasive procedure on the neck and a non-invasive procedure in the face.
Okay.
So this stuff really has come a long way. Finally, we come to fillers of the face. And you're all familiar with Restylane and Perlane and Juvederm. And you can see how it flattens the folds. So doing some combination of things with Botox and fillers and tightening procedures, you can really stave off facelifting and things like that for a while, if that's what you want to do.
Okay.
You can fill out the cheeks with fatter fillers. If you look at this, Randy, you can see how her cheek is down. She looks a little older.
On the right side, okay.
Yeah, on this right side here. But you can see how the folds of the face are diminished and the cheeks are a little bit fuller.
It's like you evened her out a little bit.
Yeah. And this is sort of the non-invasive repertoire. Is it facelifting yet? No. But does it make a real difference that 95% of the people are happy with? Yeah, it does. Okay, here's an example of fillers. We talk about losing volume, and a lot of it is really sagging of the face, where the structures of the face fall downward, giving you that tired, mad, sad type of look. But there is one area that really does lose volume. And if you look here, you can see on the outside of her eye,
yes,
toward the temple there, how that area of bone's reabsorbed a little bit. By adding just a simple filler, and in this case we also did a pixel resurfacing, you can see how we rejuvenated that eye.
Yeah, it's very nice. I mean, you kind of wiped out the crow's feet there.
Yeah, a little bit. But can you see also under the eye how that area is filled out, and it's reestablished the youthful volume that she used to have.
Interesting. Okay.
And people couldn't put their finger on it. They just thought she looked better.
Now, do you see reversals in self-esteem? I mean, people that, you see them act differently. You take care of their skin. You make them feel a little bit better.
Oh, it's a real uplift for people, women in particular. And, men and women are different animals. I don't know how to state it, but it's really true.
Okay.
With women, there's actually a hormonal response to feeling better. And they actually, when they look in the mirror and feel better, release a little oxytocin.
Interesting, okay.
And it's a self-esteem type of hormone. And that's been measured. It's a field called psychosynthesis, but it really gives a lift and makes people
So when
happy.
you do these procedures, do they report to you, I feel better, I feel happy? I mean, they don't even know why they feel happy, but do they feel sexier? Do they, what do they tell you?
Well, personally, I don't know about sexier, Randy.
Okay.
But better, yeah, they definitely feel better. And it's a real uplift for people to feel better. And there's a saying.
Do you think go ahead, there's a saying?
No, for guys, what makes mama happy makes papa happy.
All right. A lot of men I know talk their wives out of going in to do anything because they're afraid of that unnatural look.
Yeah. Well,
what do you say to these guys?
I sit down and talk to them and tell them what makes mama happy makes papa happy, basically, and they all understand that after a period of time. But we also go through a little talk about why that makes them happy and the hormonal aspects of it and everything like that. And once they see how happy their wives are and how much better they feel, they really like the fact that they've done something.
But you're about natural results. I mean, that's been your key from the first time I met you, I guess 8 years ago, is natural results.
Yeah, I like it where someone looks at the pre and post-op or pre-treatment and post-treatment pictures and they see, gee, that's a big difference. But when they look at the person, they don't really realize that anybody's had something done. That's because we're number one with ourselves and number 52 with about everybody else. Try and think about what one of your friends' noses looks like, for instance.
Yeah.
Maybe you can do that, but I can't.
You know, one of the things, though, that people, and we're just about out of time, though, that when you see bad plastic surgery out and about, or skin that's just almost like a burn victim, that people need to know you really have to be careful who you go to get these procedures done. I mean, some guys just don't have an eye for it, I think. I mean, I could say that, but I mean, do you feel that way too? I mean, you must, when you're out and about, I mean, you could spot a facelift or bad plastic surgery or, you know, an odd face.
A lot of people like a lot of different things. We like a
Is that the surgeon, though, that's doing it? I mean, who do you blame for that?
Well, you know, I have patients who want that look. I really do. And I don't.
They really do?
They really do. I want to be told pull tight by like a few people that, you know, they see on TV and that type of thing. I really think she looks great. It's not what I like. I like a natural look, a look that looks like you've lost maybe 15 plus years, but still you just look better and like yourself.
You know, you told me, because we were talking about it's a matter of taste, and I'm paraphrasing for you, but you said they even put some of these bad plastic surgery on their own websites.
Why, it's tough to call.
So that means their idea of beauty is really not that good. I mean, you think?
Well, their idea of beauty is what is shared with that patient who wants that look.
Okay.
And so is it bad plastic surgery? No, the patients want it. The doctor likes it. They're happy.
I mean, absence of wrinkles, you know, doesn't make somebody young. You know, I mean, if you make somebody remove their wrinkles, but they look odd, you know, I mean, everybody knows the plastic surgery woman that walks into the party. I mean, it's so true.
But the question is she unhappy with that look?
Okay, that's a good point. So you're defending that point. But none of yours look like that. When I look at the ones on the website, and I always say, look, obviously doctors are going to show their best work, but if your best work isn't so good, you got to worry a little bit.
Well, you know, we really don't show our best work because the website guy wants the stuff now. Okay. So we get him whatever we have.
And some of your, you know, obviously your celebrity clients don't want to let you use their photos on the website.
Absolutely true. But, you know, I still maintain that it's your own eye and what you like. Some people say bad plastic surgery is bad plastic surgery, but it really isn't. If it's what the patient and the doctor wants and it's what makes the patient happy.
But is it your job as a facial plastic surgeon to kind of guide them and advise them, hey, you don't want to look so tight? I mean, what's your role?
Well, that's my position, but other people don't have that position.
Is that right? Okay.
Yeah, and
they let a patient make a mistake. Is that a way to say it?
I don't think it's a mistake if both the patient and the doctor like it.
Right.
That's what they want. And patients seek us, not we seek patients sometimes.
You know, the other thing I want to mention, I mean, of course, I'm endorsing you, but you know, I tell people if you're going to go, you know, to a facial plastic surgeon or a plastic surgeon, make sure they have all the laser technology and all the all the things that you've talked about, so that way they're going to, you know, do the right thing for you. Because I know a lot of plastic surgeons that they don't have any lasers. They have nothing else in their practice for skin other than topicals. So do you think that's an advantage for you? That you have everything?
I think so. I like to offer patients an option of what they can do and in various stages. If all you have is a hammer, everything looks like a nail, and that's true. But if you have a lot of options, you can offer them. Sometimes it confuses people. That's the only downside of that.
Okay.
You know, they want a solid recommendation, we'll give them that. Surgery is still the best thing usually, but it's not the thing that everybody seeks necessarily, or that they're in a position to have. Jobs can get in the way. You know, you may not be able to do a facelift because you don't have the time off, or you're so busy that you can't get to it. Or you may have the time, but you don't have the money. I mean, there are a lot of reasons for doing other things.
So final message, somebody that they don't like the way they're aging, or they just want to look great for their age. What's their first move? call? I mean, do they get to meet with you, by the way, or
they do
on the consult? I mean, you do every consult.
I consult with everybody for anything that they do, and sit down and talk to them. Now, sometimes if you listen to the patient, they tell you what they want, because a lot of them have researched everything.
So they even know the type of facelift they want.
Not necessarily. They're a little confused about that.
Okay.
Yeah.
Okay.
We do a triplane facelift and lift all of the structures of the face, and that's important to us. And people don't really understand the difference, because there's an old saying, if you ask 2 surgeons, you get 4 opinions. And that's pretty true. And everybody attracts people that want what they offer.
I want to thank you for coming on the show. Good stuff. All these photos are on your website. They can go there?
They're not really.
They're not. Okay.
No, we haven't gotten around to that yet. And I guess we
But you have a lot of photos on your website.
We do have a lot, and I suppose we should revise our website, but we just, as I said,
and I've been to your office, and everybody that works there seems to be getting younger for some strange reason. Is it the stem cells, or they're dipping into the technology?
Well, like everybody else, they all have different ideas about what they want, as well as me.
I walked in there and said, boy, you have a lot of turnover every time I'm here. You go, no, Randy, these are the same people. I'm thinking you're like firing them and hiring, once you start looking old, you get rid of them. No, I guess you just keep them looking young.
No, our staff's been with us for quite a while.
Okay, good. I want to thank you for coming on the show.
Thanks so much, Randy. You've
been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go to our website at wellnesshour.com. Just put in Dr. Keller, and you can see it there, or put in non-invasive. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health.